Hi guys, let's do this NBME 11 section. First, let us start with the blue boxes. Primary amenorrhea given with ovarian failure. Do karyotyping to rule out the Turner syndrome. UTI can have hematuria in both cystitis and pyelonephritis. Chest tube is used for empyema, pneumothorax and hemothorax, whereas thoracocentesis is used for pleural effusion. Low risk tubular adenomas should undergo colorectal cancer screening every 7 to 10 years, whereas high risk tubular adenoma or villous adenoma should undergo screening for every 3 years. Cutaneous anthrax can be presented with painless necrotic rash and edematous swelling. It can involve lungs. Let's do this orange section. Anterior talofibular ligament. The test which is done to evaluate this is anterior drawer test, whereas a calcaneofibular ligament we do talar tilt test. Nitrofurantoin is only used for cystitis, not pyelonephritis. Intermittent symmetrical semi-purposeful movements. If these terms are given in the question, it clearly indicates some toxicity. Motor pathway and brainstem pathways are intact. Strongest risk factor for in-hospital mortality in a patient of DVT and pulmonary embolism is age. If the patient presents with grade 3 ankle injury, do short-term immobilization. Evaluate serum osmolality as the first step in hyponatremia. The formula to evaluate serum osmolality is 2 into sodium plus blood urea nitrogen by 2.8 plus glucose by 18. Muscle biopsy is meant for genetic myopathies, whereas CK is meant for other myopathies like Duchenne, Becker's. Lupus pleuritis treatment, add NSAIDs, not steroids. Hyperemesis gravidarum treatment, pyridoxine, doxylamine and IV fluids. Let's start with the uncolored portion. Ovarian cancer treatment, surgery plus chemotherapy. Don't choose tamoxifen. If the fascia is penetrated, do exploratory laparotomy. If fascia is not penetrated, do local wound exploration. Stable bronchiectasis. If the patient is stable, do an airway clearance. If the patient is ill and have fever and symptoms like cough, purulent sputum, add antibiotics. Infants arching after feeding with vomiting, it indicates GARD, Sandifer syndrome. Pregnant female plus friable cervical lesion plus painless bleeding, this indicates a cervical cancer. The difference between type 1 and type 2 errors is type 1 indicates a false positive, that is difference exists when it actually doesn't. Type 2 indicates a false negative, there is no difference exist when one actually does. Soft tissue sarcoma in thigh can present with meds to lungs. Do a CT chest to evaluate this. In urinary incontinence, if PVR post residual volume is given like a 500 ml, the answer is overflow incontinence. Always prioritize this than other features. Do not use vitamin E prophylaxis in stroke prevention, it is not useful. In window period in hepatitis, anti-HBC IgM antibody is positive. Acute stress disorder requires a trauma history. Opioid overdose can present with hypertension. Psychogenic functional tremors are present in conversion disorder. This is a very important statement regarding carpal tunnel syndrome. Almost every NBME you get this topic. The treatment is starting with a wrist splint plus ergonomics. Ergonomics like adding wrist pad while using mouse, etc. And followed by, if this fails, you have to go with the steroid, intra-articular steroidal injection. If this fails, you have to go with the surgery. In the question, if you see something like empty rectum with constipation, most probably it should be Hirschsprung's disease. Patient, if suppose patient asks you about the probability of disease after the test is positive, uh, the term that should describe the statement is PPV, positive predictive value. If he asks like how much does the test changes odds, it is likelihood ratio. If you hear something like odds, it has to be like likelihood ratio. Urticaria is a systemic feature. To prevent recurrence, use venom immunotherapy. If you see this term supraclavicular fossa distension with inspiration, it means pneumothorax. If the patient is has a history of smoking and family history of MI, screen for lipids. Diabetic education is a tertiary level of prevention because the disease has already occurred, so it has to be like a tertiary level. Don't give beta blocker in acute decompensated heart failure. Diabetic foot ulcer, the most common organisms are mixed aerobic and anaerobic. Potassium iodide is used in thyroid storm and pre-op preparation. It is not used as initial therapy in Graves. If the child presents with hypertension and renal labs are normal, do a renal ultrasound Doppler even if labs are normal. If you ever see a prostate nodule on NBME, just do the biopsy. Rash seen 7 to 14 days after MMR vaccine, plus the child is well. This most likely to be vaccine viral replication. Several days of fever with seizures followed by rash after the fever is subsided. The diagnosis is roseola. History of trauma plus epigastric pain. The diagnosis is traumatic pancreatitis. Opioid overdose presents with meiosis less than 2.5 millimeter. Lesions progress. If the lesions progress at the same rate, it is most likely to be as smallpox. Versus if the lesions progress at different rate, the most likely answer gonna be chickenpox. In cardiac trauma, even if the patient is stable, admit and do serial ECGs and also TROPS. If the patient has AFib and the patient is stable and the heart rate is less than 500, observe and treat the underlying cause. Ottawa angle rules. No X-ray to be done if the patient can walk 4 steps unassisted. Just use soft brace plus physiotherapy. These are the side effects of calcium channel blockers: peripheral edema, headache, flushing, gingival hyperplasia, lightheadedness. And this topic also gets repeatedly asked in almost every NBME. Quite common variable immunodeficiency. Recurrent sinopulmonary infections seen in 20s to 40s. Measure immunoglobulins and the definitive treatment is replacement with the IVIG. Stress fractures. Do a cast immobilization and rest. Dubin-Johnson syndrome, ABCC2 gene mutation controlling MRP2 protein. Switch to tracheostomy if patient is intubated for 10 to 14 days for better breathing and easier weaning. Most common cause of septic arthritis in all age groups. This is gold standard one, Staph aureus. Thank you.